Hello, I'm Dr. Emily Carter, and today we're going to talk about something that can completely change the way you experience intimacy after 50. Most men spend their whole lives trying to get stronger, last longer, stay harder, believing that performance alone defines pleasure. But here's the truth. After 50, your body starts teaching you a different lesson. That real satisfaction doesn't come from endurance. It comes from understanding. You see, there's a place, small, overlooked, and far more powerful than the so-called G-spot that most men never learn about. It's not deep inside, it's not hard to reach, but when you find it, when you touch it the right way, you unlock something that feels completely different for her and for you. And the best part? It has nothing to do with your stamina or even your erection. It's about rhythm, precision, and connection. Today, I'm going to show you where it is, why it works, and how mastering it can turn anxiety into confidence and routine into real passion. Most men believe that if they can just improve their stamina, if they can last longer or stay harder, everything else will fall into place. But that mindset, that pressure to perform, is exactly what makes intimacy start to feel mechanical, even stressful. When every encounter becomes a test of endurance, you stop listening. You stop noticing her breath, her reactions, her subtle cues. You focus so much on doing it right that you forget to feel. That's when connection fades. The truth is, many couples, especially those in their 50s, 60s, and beyond, reach this same point. They care for each other deeply, but something feels off. Touch feels routine. Excitement fades faster. You might even start thinking, maybe that's just age. But it isn't. The problem isn't desire, it's direction. You've been taught to chase performance when the real key lies in precision. Most men fixate on one place, the G-spot, like it's some magic switch that guarantees fireworks. But what if that search has been distracting you from an area even more powerful, more reliable, and far easier to reach? There's a reason many women smile knowingly when they hear about the G-spot, because they understand it's only a fraction of the story. The real pleasure network is much broader, more connected, and within that network, there's a small zone that often goes completely overlooked, even though it holds the potential for the deepest, most natural satisfaction a woman can feel. This isn't about tricks or secret moves. It's about learning her anatomy the way it truly works, not the way magazines describe it. And once you understand it, everything changes. You stop worrying about lasting long enough and start focusing on the moments that actually make her melt. In just a moment, I'll show you where this hidden zone is, how to approach it with confidence, and why it works especially well for mature couples, where tenderness matters more than intensity and connection outlasts performance. Now, let's talk about this hidden zone, the one most men never learn about, yet almost every woman secretly wishes they did. It's not deep inside. It's not mysterious or hard to reach. In fact, it's right at the entrance, just a few centimeters in, where the inner wall meets a cluster of delicate nerves and vascular tissue. Anatomically, doctors sometimes refer to it as part of the anterior vestibular network. Others call it the A-spot, but you don't need the medical terms. What you need to know is this: it's the bridge between the outer and inner pleasure zones. It connects directly to the clitoral network, to the urethral sponge, and to the pelvic floor muscles, the trio that controls almost every sensation she feels. Think of the entire system like a musical instrument. The clitoris is the melody, bright, sharp, and easy to hear. The deeper zones, like the G-spot, are the bass notes, rich but sometimes hard to reach. The area I'm talking about today is the resonator, the part that ties everything together and makes the whole song come alive. When you touch it the right way, something remarkable happens. Sensations ripple outward. The pleasure doesn't just stay in one spot. It travels, igniting other areas of the body through shared nerve pathways. And because this zone sits close to the surface, it responds beautifully to gentle rhythmic pressure, not force, not speed. That's why it works so well for mature couples. You don't need energy or strength, just patience, consistency, and care. For women in their 50s, 60s, or beyond, hormonal changes can sometimes make arousal slower or sensitivity lower. But this zone remains incredibly receptive because it's rich in blood vessels that still respond strongly to touch and warmth. With the right approach, stimulation here can restore that full body pulsing pleasure that many couples think disappears with age. You might be wondering then, if it's so important, why doesn't anyone talk about it? The answer is simple. Most education about intimacy focuses on penetration or climax, not connection. No one ever teaches men that the path to a woman's deepest pleasure starts just a few inches in and depends far more on rhythm and awareness than stamina or size. Once you understand that, you start seeing intimacy differently. It's not a race, it's not a performance, it's a slow dance. And this small, overlooked spot is the rhythm section. It's what keeps both of you in sync. In the next part, I'll show you exactly how to find it, and more importantly, how to touch it in a way that feels effortless, confident, and deeply satisfying for both of you. Here's how to find it, and how to touch it the way her body truly responds to. First, slow everything down. This isn't about rushing toward a goal, it's about building connection moment by moment. Start with warmth, soft kisses, gentle strokes. Let her body unfold at its own pace. Most women, especially after menopause, need more time for blood flow to reach the inner tissues. Around 10 to 15 minutes of foreplay is ideal. During that time, you're not just preparing her body, you're preparing trust. When you're ready to explore inside, make sure your hands are clean, nails trimmed, and there's plenty of lubrication. A water-based one works best. Then slowly insert 1 or 2 fingers just to the first or second knuckle. You're not going deep. The spot you're looking for sits near the front wall, toward her belly, just past the entrance. Use the pad of your finger, not the tip, and apply a slow, steady, come here motion. You'll notice the texture change slightly. It feels softer, spongier, and warmer than the surrounding tissue. That's it. That's where you stay. Keep your rhythm calm and consistent. About 1 or 2 gentle curls per second. Don't jab. Don't pull out and push back in. Stay in contact. Let the pressure roll through your fingertip like a wave. What makes this spot special isn't depth, it's direction. Most men go straight in, then push upward, thinking they're finding the G spot. But that movement often misses the nerve-rich cluster just beneath the surface. The secret is subtle upward pressure, not too firm, not too light, and a steady tempo that matches her breathing. You'll know you're close when her body starts to react on its own. Her hips shift, her muscles tighten gently around your finger, her breath changes. That's your cue. Stay there. Keep the same rhythm. Don't change pace unless she asks you to. If you want to take it further, use your other hand for light external stimulation. Gentle circles around the clitoral hood or soft caresses along the inner thighs. The goal isn't to do more. It's to connect the sensations inside and outside so they build together. Think harmony, not competition. This technique works beautifully for older couples because it doesn't require athletic stamina or intense movement. You're using awareness instead of force. The muscles in your forearm barely work, but your attention does. And that's what she feels the most, your focus. One more important point. Don't start this before she's fully aroused. When blood flow fills the area, the tissue becomes thicker, more cushioned, and far more responsive. If you try too early, she might feel discomfort or dryness, so take your time. When she's ready, you'll feel the difference. The tissue almost seems to rise toward your touch. That's your moment to begin. Over time, as you both learn this rhythm, something shifts. It's not just about stimulation anymore. It's communication through touch. The steady, thoughtful movement tells her, I'm here, I'm listening, I care. And that message is often what reignites real desire, even after years together. In the next part, we'll talk about how this single technique, once mastered, can restore confidence, reduce anxiety, and completely transform how you see intimacy as you age. So now that you understand how it works, let's talk about bringing it into your real life. Not as a one-time trick, but as a quiet ritual of connection you can share again and again. Start by letting go of the idea that intimacy has to look the way it did decades ago. You've both changed, and that's not a loss. It's an evolution. With age comes patience, deeper awareness, and a new kind of confidence that only time can give. So tonight, remember, slow down, breathe, explore. She's not hoping for perfection, she's hoping for connection. And when you give her that, you'll both feel younger than you have in years. I'm Dr. Emily Carter. Thank you for joining me today. If this conversation helped you see intimacy in a new light, make sure to subscribe for more discussions on senior men's health, confidence, and connection. Because pleasure isn't about age, it's about understanding. And understanding starts here.